Hello. This topic is a little different, probably a little harder to talk about for some people than other topics I've done in the past. This one is on basic hygiene. Hygiene is typically thought of in terms of proper hand washing, body washing, facial cleansing. Although these practices are essential to overall cleanliness and interrupting the spread of disease. Another component of good hygiene consists of practicing good hygiene etiquette. Um, Basic personal hygiene is the process of maintaining cleanliness and personal grooming. It is important for everyone not just to be a happy member of society, but also for the health purposes. People who fail to practice basic hygiene skills are more likely to become sick themselves or to make other people ill by spreading germs. In general, basic hygiene refers to bathing regularly to cleanse the skin and the hair, keeping the nails clipped and clean, brushing your teeth, and wearing deodorant. Bathing or showering daily is the cornerstone of basic hygiene. It helps to prevent body odor, keeps the skin healthy, and can prevent some skin conditions that occur if the skin is not cared for properly. I have had a few hairstylists say that washing your hair every day isn't good for your hair and that you should wash your hair every other day. So when you shower daily on every other day, you can just rinse your hair thoroughly with. Um, Also, if you are someone who exercises or just sweats a lot, sometimes 2 showers a day might be necessary. Soaps, toothpaste, and possibly even shampoos should ideally be antibacterial. Long, luxurious baths may be a relaxing mental balm, but can even and they can even help ease tired and strained muscles. But for the purposes of personal hygiene and cleanliness, most studies indicate that showers do a much better job in cleaning. When taking a submerged bath, bacteria and germs swirl around inside the bath water, even ending up right back where they started, on the skin. Showering washes germs and bacteria off the skin and hair down the drain. Personally, when I take a nice bath, I take a bath to relax and then shower to wash the bacteria away right after. Um, it is also typically necessary to apply deodorant at least once per day. For even though body odors does not directly impact physical health, it can have a profound impact on social acceptance and mental health. Being a bigger woman, I sweat throughout the day and apply it 2 or 3 times a day if necessary. Typically, I do this right after my shower and dry myself off. It is also important to wear clothing that is clean and freshly laundered, and if possible, to quickly remove any clothing that is soiled. Other ways to help promote personal hygiene and cleanliness include frequent changes of underwear and changes of outerwear when necessary. The longer that clothing remains on the body, the more germs and bacteria get attached to it. Clothing also magnifies body odor, so using a good antiperspirant and deodorant is essential. After going to the bathroom, also make sure you wipe, sufficiently to prevent infection. And also you want to make sure you wash your hands. Washing your hands throughout the day is another part of basic hygiene, such as after using the restroom. This is not just important for personal cleanliness, but to prevent the spread of diseases. I mean, we all know what's going on in the world right now, and they say we should, we even be washing our hands more than normal. And most workplaces post a sign in the restrooms that require employees to wash their hands before they return to work. Other workplaces might even require employees to wear gloves as well, such as those in the fast food industry. Keeping the teeth clean and healthy is another important aspect of basic personal hygiene. This involves brushing the teeth twice per day and flossing at least once. Studies seem to show that brushing and flossing after every meal is the best way to keep bacteria in the mouth at a minimum. It also helps prevent gum disease and tooth decay while maintaining a fresh, clean smile. Using an antibacterial mouthwash after brushing can freshen breath as it kills any remaining germs or bacteria. I don't personally brush after every meal. I tend to brush and use mouthwash first thing in the morning and right before I go to bed. I don't really take care of my teeth when I was younger, so even when I do brush, they still appear to be yellow, and I also have, bleeding problems, so they bleed quite a bit, which can get stained onto my teeth, and so it looks like my mouth's constantly bleeding even when it's not. Grooming your hair is part of your daily care as well. This may include washing and brushing of the hair, and for men, shaving the face, or trimming, a beard if they have a beard. It is expected that anyone who is part of society or part of the workplace should look groomed and clean every day. In some cases, it may even be possible to lose a job if basic personal hygiene standards are not kept. Bacteria often lodged underneath the fingernails and toes, and sometimes it takes more than a shower and hand washing to properly cleanse those areas. It is a good idea to use sterilized nail file to get underneath the nail to remove any dirt and grime that may be lodged there. In addition, longer nails harbor more dirt and germs than shorter ones, so it is probably a good idea to keep your nails trimmed. Also, if you are a woman, you want to make sure that you change your tampon or pad regularly. Women who use tampons should change them at least once every 4 to 6 hours to reduce the likelihood of getting toxic shock syndrome. Women who use pads should change them every 4 to 8 hours. If you plan on sleeping more than 8 hours, then you need to wear an overnight pad instead of a tampon while you sleep. If someone you know hasn't bathed or appears unkept, it could be a sign that he or she is depressed. When people are sad or depressed, they neglect themselves. Talking about the importance of proper personal hygiene for preventing illness and providing personal hygiene items may help some people. Be candid but sensitive and understanding in your discussion. Despite your best efforts, your friend or loved one may need professional help. You should encourage them to see a counselor or doctor if their personal hygiene doesn't improve. Personal hygiene is extremely important for health, for social grace, as poor personal hygiene can be detrimental to both. The first and foremost part of avoiding poor personal hygiene is to identify and correct any existing hygiene problems. Upon doing so, it is important to develop and to stick to a rigid personal hygiene regimen that includes a variety of daily practices, as well as some practices to be conducted regularly but less frequently. Let's see. It may also be difficult to successfully improve one's hygiene without external input, so seeking advice from friends and family can be very helpful. Asking for hygiene advice can be very difficult and uncomfortable, but friends and family can offer valuable aid and will certainly appreciate one's attempt to improve your hygiene. Admitting that one has a poor hygiene problem and making the effort to correct specific hygiene problems is the first and most important step to cultivating good hygiene. Some issues may be readily apparent and easily correctable, such as infrequent bathing or poor personal dental care. Others may be less apparent, particularly if one has become accustomed to them. So if they've become accustomed, of doing things one way and then it's not good for their basic hygiene, trying to correct this may be more difficult. Correcting the most fundamental problems will not have a lasting effect on poor personal hygiene unless one develops and adheres to a strict hygiene regimen. A basic hygiene regimen might include daily bathing, brushing, and deodorant application, as well as flossing one's teeth, which can be performed several times each day. Furthermore, regular aspects of preventing poor personal hygiene may involve keeping one's hair a manageable length, Mine's pretty short. I know when it gets too long, I have a hard time dealing with it. But seeing a dental hygienist a couple times each year and confronting specific issues such as bad breath or body odor. Again, regularly asking friends and family to point out any hygiene issues can greatly help one to prevent bad hygiene. Though not a direct aspect of personal hygiene, but working to maintain clean and orderly living condition can greatly aid one's attempt to prevent poor hygiene. Personal cleanliness issues become more apparent when contrasted with a clean and orderly environment. Also, unclean surroundings, particularly one's bed sheets, shower, and other often used household fixtures, can dramatically affect hygiene. Preventing poor personal hygiene often involves a drastic change in lifestyle and altering one's surrounding to reflect that change, which can greatly help and ensure that the changes are not just temporary. This is where I'm going to get into talking about the personal aspect of it, because I think telling a personal story may be able to help somebody and may make the problem more common. So personally, I know how embarrassing it can be to have a hygiene problem. I was putting on deodorant throughout the day. I was doing everything that I should, but it didn't appear to be strong enough, and people around me could still smell me, but I couldn't, so I didn't realize there was a problem. I had a few people tell me about the problem, even though I was embarrassed when it happened. I was glad that they told me. I even remember crying while they were telling me because of how stressed I was. But I'm glad they told me. I was then able to find a solution and find a clinically strength deodorant and was able to address the problem. So I hope this video helps someone. I know it's a very difficult topic. So goodbye for now. I look more forward to doing more of these videos.